Hello friends, our today's topic is maxillary central incisor. We know we have 4 upper incisor in our teeth. 2 are maxillary central incisor and 2 are maxillary lateral incisor. After that we have canine and then premolars and then molars. Today we will be discussing the anatomy of the maxillary central incisor. As you can see, this is the first picture is the labial aspect of the maxillary central incisor. Second picture is the lingual aspect of the maxillary central incisor. Third is the mesial aspect of the maxillary central incisor, and then fourth distal aspect of the maxillary central incisor, and the last is the incisal aspect of the maxillary central incisor. So we will discuss it one by one. As we know that maxillary central incisor is wide mesiodistally. So first we will discuss the labial aspect. The first is the labial aspect. When we see the maxillary central incisor from the labial aspect, the cervico-incisal height of the central incisor will be 10 to 11 mm.
Height from
The cervical margin of the tooth to the incisal edge of the central incisor, this will be 10 to 11 mm. And the mesiodistal height, that is the greatest height from the mesial aspect of the central incisor to the distal aspect of central incisor, this will be mesiodistal dimension will be 8 to 9 mm at the contact area, whereas at the neck of the tooth here it will be 1 to 1.5 mm less than the actual mesiodistal dimension. So here you can see the root will be cone shaped. The root will be cone shaped, and the root length will be 2 to 3 mm longer than the crown. So usually it will be around 12 to 13 mm. So this was all about the labial aspect. Then coming to the lingual aspect, as you can see,
this aspect is from the lingual view of maxillary central incisor.
This is the lingual aspect of the maxillary central incisor. Here you can see this will be the mesial part, this will be the distal part. So it will be the reverse of the labial part. Here you can see a depression. This is the lingual fossa, and this elevated part is the cingulum. So the cingulum is the smooth the convexity below the cervical line. Here in mesial side there will be elevated part known as mesial marginal ridge, the distal part distal marginal ridge, and here the elevated part of the incisal edge will be the incisal ridge. So this depression will be called lingual fossa, which will be surrounded mesially by the mesial marginal ridge, distally by the distal marginal ridge, incisally by the incisal ridge, and upper by the cingulum. So the lingual fossa will be the shallow concavity, and the crown will taper lingually. So this was all about the lingual aspect. Now coming to the third part, that is the mesial aspect. So the mesial aspect of maxillary central incisor will be wedge shaped or the triangular shape. Here the base will be at the cervical line and the apex will be at the incisal edge.
As you can see in this picture, this is the reverse triangle where the tip of the triangle is at the incisal edge.
And the root will be straight. Now coming to the distal aspect. At the distal aspect, as you can see, the crown will be thicker at the incisal edge because as we move
from the mesial to distal side, the crown moves distally.
There will be slight angulation of the tooth, so the distal aspect will be narrow and the crown will be thicker at the incisal edge. We can see the labial part of the central incisor from the distal aspect. and the root will be same. Coming to the incisal aspect, incisal aspect is the last part of the central incisor. Here you can see the labially it will be broad and flat, and lingually it will be taper, and the crown will be bulky.
So this was all about central incisor.